ชื่ออะไร
คุณจำผมไม่ได้แต่ผมจำคุณได้คุณชื่อวันดีสามีชื่อบุญส่งคุณเป็นคนรักต้นไม้ชอบสีฟ้าใส่รองเท้าเบอร์6ขี้หนาวแต่ชอบกินน้ำเย็นชอบแกงเผ็ดแต่ไม่ชอบมะเขือพวงแล้วเวลากินข้าวคุณจะต้องฟังเพลงนี้คุณเป็นคนรักธรรมชาติเส้นตื่นมีระเบียบรักความสะอาดตลกขี้บ่นขี้งอนแล้วก็เป็นอัลไซเมอร์
Background of the Alzheimer's. It was discovered in 1906 by a German physician named Dr. Alois Alzheimer. Following up the relationship between the brain and Alzheimer's. Alzheimer's disease can lead to cell death, tissue and tissue loss, in which it affects nearly all its functions. What occurs in the brain of Alzheimer's patient?
Scientific research has revealed some of the brain changes that take place in Alzheimer's disease. Abnormal structures, called beta-amyloid plaques and neurofibrillary tangles, are classic biological hallmarks of the disease. Plaques form when specific proteins in the neuron's cell membrane are processed differently. Normally, an enzyme called alpha secretase snips amyloid precursor protein, or APP, releasing a fragment. A second enzyme, gamma secretase, also snips APP in another place. These released fragments are thought to benefit neurons. In Alzheimer's disease, the first cut is made most often by another enzyme, beta secretase. That, combined with the cut made by gamma secretase, results in the release of short fragments of APP called beta amyloid. When these fragments clump together, they become toxic and interfere with the function of neurons. As more fragments are added, these oligomers increase in size and become insoluble, eventually forming beta amyloid plaques. Neurofibrillary tangles are made when a protein called tau is modified. In normal brain cells, tau stabilizes structures critical to the cell's internal transport system. Nutrients and other cellular cargo are carried up and down the structures called microtubules to all parts of the neuron. In Alzheimer's disease, abnormal tau separates from the microtubules, causing them to fall apart. Strands of this tau combine to form tangles inside the neuron, disabling the transport system and destroying the cell. Neurons in certain brain regions disconnect from each other and eventually die, causing memory loss. As these processes continue, the brain shrinks and loses function.
What are the symptoms of Alzheimer? There are three main stages. There are early stages, middle stages and later stages. In early stages, they will experience loss of memory, difficult to remember the names, and changes their decisions. Next, they experience confusion as well as difficulty in remembering the names and putting things. Also, having vision problems, mood changes and trouble in completing basic tasks. Note that they need someone to support them. Later stage, they will experiencing delusions and neglect their hygiene, which need full-time care. How Alzheimer is diagnosed. It can be diagnosed only through autopsy after death by examining the brain tissue. However, there are several methods and tools to identify the problem. The following criteria may be used to diagnose the Alzheimer's disease. By checking the patient's records such as family history, any other medical illness, and so on. Also, use mini mental state, which involve the attention span, memory skills, and problem solving. Physical assessment is taken to determine the treatment. X-rays on chest is taken to view inside upper body as well as to indicate any other disorders. Not to forget about the brain scans, which are computed tomography and MRI scan. So, what are the treatments for Alzheimer's? Hello, I am your doctor and here to help you. Alzheimer's affects older population, and in Malaysia is about 50,000 who have Alzheimer's. We need all of these people in treatment. The treatment provides medications and therapies. These are some medications used to treat certain problems related to Alzheimer's. Therapies are also essential in the treatment. Medications and therapies only slows down the progression, but won't stop it. So give them what they are most need, such as love. So, let us all work hand in hand for better health. Is it possible to cure Alzheimer? With medical illness lead to early mortality, which has the average lifespan of 8 years. However, it can be delayed with medications such as Aricept, Exelon, and others. Early prevention can be done by taking healthy diet. Last but not least, prevention is better than cure.